subscribe now and press the bell icon. Never miss an update.
Hello and welcome to Health Live at Seniors Today. We are delighted to have here with us once again Dr. Dilip Shah. Dr. Shah, people from Seniors Today, those who have been regular here and those who have attended our singing contest, Seniors Have Talent, is a well-known orthopedic surgeon. He is attached to the Saifi Hospital, the Nanavati Hospital, the St. Elizabeth, and the Kambala Hill Hospitals. He was earlier with the HN Harkishan Das, which is HN Reliance, and the Nair Hospitals. He's a panel consultant with the ONGC in Mumbai. Dr. Shah is an honorary professor in orthopedics and has a teaching experience of over 39 years. As I mentioned, he's attached to various hospitals like Saifi, Nanavati Max, St. Elizabeth, and Kambala Hill Hospitals. He was the winner of the SICOT Fellowship to Italy in 1985 and the winner of the AOF Fellowship in 1995, the winner of the BOS Fellowship in 1989. He has been an honorary orthopedic surgeon in Nair Hospital, Breach Candy Hospitals, to name a few. At present attached to, as I mentioned earlier, to Saifi and Nanavati Max. He's an instructor for AO courses since 1985. He's a recognized professor in the University of Mumbai and examiner for postgraduate MS exams. He's a recognized inspector for recognition of hospitals for postgraduate teaching, editor of the ASOR, the editorial board member for the Forte Journal of Orthopaedics and Sports Medicine. Dr. Shah has been featuring in many publications and pages at the national and international level. He's attached to many orthopedic organizations in various capacities, organizer of conferences, chairman and speaker for many conferences, and national coordinator from India for the AOS Saturday conferences from Chicago. He has done a huge number of webinars during COVID lockdown. But I must say here that above all, he's a friend of Seniors Today. I must confess here that we had a bit of a problem today with at this event, and I approached him almost at the last minute, and I said, "Sir, you must, can you please take a session here?" And he kindly consented. Apart from that, I must also tell you that he is one of our singing superstars. He is a winner of one of the seasons that we've had so far. The 8th season starts on August 17th, and he has been the winner, a worthy winner. I must confess, I did not, I had heard of him as a leading orthopedic, but, he floored the audiences with his singing in that season that he was there. Thank you very much, Dr. Shah, for being here, and welcome to Health Live at Seniors Today once again.
Oh, thank you very much, Mr. Pradyumna, the editor of Seniors Today. And it was my good luck, in fact. You should not feel that you told me at the last moment. I have told you, you have the authority to tell me even 5 minutes before your event, and I am there with you because I love Seniors Today so much. So without wasting much of the time, I'll start sharing my screen so that we can go ahead with the presentation which I want to make. Now, this presentation which I want to make is of dual fold. One will be at your basic level.
Synvisc, the visco supplement for extended relief of osteoarthritis.
So as you're aware, Dr. Shah is going to be talking about osteoarthritis. And over to you, Dr. Shah, for your presentation, and then we'll...
Certainly, sir. Thank you so much.
And those of you who have questions, as always, please post your question in the Q&A tab with your gender and your name and your age, so that Dr. Shah is able to give you a more considered reply. So just put it in the Q&A tab or in the chat window, and I will pose the questions to Dr. Shah as soon as he finishes his presentation, which will be around 20-25 minutes from now. Over to you, Dr. Shah.
Thank you so much. I am Dr. Dilip Shah. I want to talk to you about osteoarthrosis. We call it in doctor's language. Arthritis is usual common nomenclature given by ordinary people. I will talk to you about current treatment options because As you know, that osteoarthritis is the second most common rheumatologic problem, and it is the most frequent joint disease with prevalence of 22% to 39% in India, up to 45% of women over the age of 65 years having symptoms, and up to 70% showing radiological evidence of OA, often impacting on the mobility. They walk like duck waddle. OA was estimated to be the 10th leading cause of non-fatal burden. There are many factors which give rise to osteoarthritis: infection, aging process, sex-wise, ladies are more prone for that, congenital factors, genes, obesity, joint overuse, like those who are marathoners and those who are sprinters, they thump their feet on hard surfaces also and cause this, joint trauma, surgical intervention, or other systemic factors. And you can also see it could be probably due to a reduction in quality of life, you become sedentary. COVID has made practically everyone and gain weight. Pain, which increases joint destruction, joint instability, muscle weakness, and ultimately disuse, atrophy of the muscle. For your info, this is the normal joint. What you can see here is the bone, and at the bone, you have the cartilage. This is a cartilage, and if you see the magnified view, it's here. In osteoarthritis, the focal point is the disintegration of the cartilage. The cartilage becomes rough. Like you have a smooth formica on a table, and if you remove the formica, the table is rough. And with the disease, cartilage wears out. There are cracks and fissures over there, and cartilage becomes very thin and dry. So, high joint loads, bone remodeling, disruption of the cartilage, access to chondrolytic enzymes, loss of aggregates, and progression of loss of cartilage, that is osteoarthritis. And this is a very complicated way in which osteoarthritis progresses. Let's see the pyramid, how we can treat osteoarthritis. One, non-pharmacological, that means you don't take any drugs, but there is education, exercises, prevention of joint injuries, weight loss, orthotic devices, and then topical application, like on skin, you can apply NSAIDs, capsicum, and some patches, or you have rubefacient ointments which work by counter-irritant principles. Oral, you can take paracetamol. You have taken lots of Dolo and Lenoliar. Non-inflammatory kind of treatment, and we have opioids and duloxetine kind of medicines. We can give you intra-articular injections of corticosteroid or hyaluronic acid. And there comes a stage where nothing going to work, then you need surgery. Surgery, I'll give you in details when we come to that. And these are the medicines which are utilized for osteoarthritis, but most important above all is exercise, weight reduction. You cannot replace, like Vidya Balan had said, that entertainment, 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 same way. Exercise, weight reduction, exercise, weight reduction. That's the mainstay. There are lots of nutraceuticals like glucosamine, chondroitin sulfate, and you can add with them paracetamols and some kind of painkillers. But life is movement, movement is life. And that's our motto, that we should allow you to have proper kind of treatment. Viscose supplement, for your information, our knee joint has some kind of fluid, which is known as synovial fluid, and that becomes dry. And when we give injections of similar kind of knee joint fluid, it is known as viscose supplementation. And there are various types of them. Intra-articular injections and the viscose supplements, they help you. The mechanism is basically, it protects the cartilage, which is known as chondroprotection. It lubricates. And below the bone, there is a layer of subchondral bone, which also becomes stable. It works as a painkiller. It works as an anti-inflammatory. And then it works as a shock absorber also. And there are various types of viscose supplements available.
Synvisc, the visco supplement for extended relief of osteoarthritis. Watch the high molecular weight Synvisc as it surrounds and permeates the joint. Synvisc glides over the articulations of the femoral condyles, tibia and surrounding structures, providing a lubricating, shock-absorbing surface on which the condyles can move easily.
You can see the worn-out surfaces, okay?
Within synovial membranes, it's hypothesized that Synvisc also permeates the surface layer of surrounding structures, such as cartilage, intra-articular ligaments and synovium. Like healthy young synovial fluid, it lubricates and cushions these delicate tissues.
So it lubricates and gives you a shock absorber effect, but it is not forever. You may need to repeat after 6 months or 1 year, and you can buy time of a joint replacement surgery by around 5 to 10 years. You can have combination of such injections also, like you can add steroid. Now, these steroids are different from what you think are steroids, so they are not harmful unless they are given repeatedly to the tune of more than some 10, 20 times. There is something known as platelet-rich plasma that also can be injected. So much for less invasive kind of methods. When osteoarthritis has gone to the level which is very painful, life is in difficulty, then you need surgery, and then there could be surgical treatment, which is basically for symptomatic treatment, or joint restoring procedures like we do cell transplant, or joint alignment procedure. When the knee is little crooked, you try to make it straight by cutting the bone, which is known as osteotomy. And joint replacement could be mainly uni-compartment, only one compartment to be replaced, or total knee replacement, whereby we replace all components of the knee joint. Osteotomy is basically, if you see here, this is a normal knee. And when we drop a line from center of your hip to the center of the ankle, it is in the center of the knee. Whereas in osteoarthritis, from center, when you put it on the ankle, it goes on the inner side. So this is known as varus deformity. Quite often it could be other way around, which is known as valgus deformity. So what we do is cut a wedge of bone from the tibia bone and then close the gap and make it straight. I hope you understood. Or we cut the bone and open the wedge and correct the deformity. Or we cut in the shape of a barrel and vault, or known as dome osteotomy, and make it straight. This is what is osteotomy. That can buy you 5 to 10 years. But then after that, it becomes difficult to do a replacement of the joint. High tibial osteotomy, we can fix it with a plate so that patient can be mobilized very quickly. This is how we cut the bone, open up the wedge, and fix the bones up and down so that patient can be mobilized very early. And they have different kind of jigs through which we can have different angles in which we can cut the bone. We can also put it by fixing up with an external fixator shown by one Russian professor, Ilizarov, and patient can walk immediately after that. And as the patient is advancing, we can do the correction gradually. This is the ring, and this is the Ilizarov method. This is how you will see at the end of healing of the bone. So, these are some of the examples of that. The bone has been cut here. It was open wedge, and it has been fixed. Now, by doing a telescopic examination of the knee, which is known as arthroscopy, we can do debridement, but that gives you only 6 months. It's like a man's beard. If you shave it, it's going to come out tomorrow. So the advantage of this remains only for a couple of months, maximum 6 months. So it is better to be described and then condemned. When the joint goes to a level where the patient is in too much of pain, his daily activity reduces, then we have options of doing joint replacement. Unicompartmental, as name suggests, is only one compartment which is replaced. For your information, there are three compartments in the knee. One is the inner side, other one is the outer side. And then this is the kneecap articulating with the femur bone. These are the three compartments. So when only the medial compartment or the outer compartment, more often it is the medial compartment. Then we replace only that point, which becomes almost like an OPD procedure. Maximum stay is either 1 day to 2 days and patient goes home. This is how this joint, you can see very well, it is degenerated. This is how it has been replaced. And this is how they get the movements. But there are a risk of unicompartmental failures, because if the surgeon has not checked out your stability of the joint by examining the cruciate ligaments, and he does it, and if anterior cruciate ligament was lax or not functioning well, it can fail, or it could be some other problems. So the positive outcomes are good, but then rather than jumping too prematurely, because unicompartmental knee replacement was popular, again went into not so popular, and again it has become popular. But we would reserve to total knee replacement if the patient is not very badly incapacitated. So I would say that let the patient beg for total knee replacement rather than me offering the patient a knee replacement. So the total knee replacement is we replace all three components: the lower end of femur, the upper end of tibia, and quite often the kneecap, which is patella. We can also give cell-based therapy, where we can actually transplant the autologous cells, and we can put mesenchymal stem cells, like what everybody would ask, what is stem cell? You can try that also. These are the stem cells which can be implanted, transplanted. Like balding, you put hair transplant. Similarly, we can do mesenchymal cells, or we can do cell transplants. But there are very emerging facts which you should know, and there are some myths I want to really get rid of from your minds. Osteoarthritis is just joint wear and tear. No, osteoarthritis is commonly typified by structural cartilage changes. However, there are also changes in the muscles, bone, and synovial tissue at the joint. Hence, it is best to conceptualize osteoarthritis as a syndrome or a collection of signs and symptoms rather than only one problem. The worse the imaging looks, the worse the joint is. Not so true, because quite often we see X-rays which are showing changes of osteoarthritis, and they don't have any difficulty. They should not be put to surgery. So imaging is a standard tool used to diagnose osteoarthritis. However, only half of the people with radiological osteoarthritis have clinical symptoms. As such, the assessment of a person's signs and symptoms may be more clinically relevant than the imaging findings. Furthermore, clinical guidelines suggest that requesting an X-ray is not required to make the diagnosis of osteoarthritis and is potentially problematic, and it reinforces the mechanical view of the disease. It was traditionally considered to be a non-inflammatory, that's why we used to call it as degenerative process, but now we have found some inflammatory process also. The synovial tissue inflammation is believed to be one of the key intra-articular processes that contributes to nociception and the subsequent pain experience with the inflammatory changes leading to intra-articular swelling. So this is what causes the pain. Moreover, outside the joint, which is known as extra-articular structures, can also be inflamed and contribute to the generation of nociceptive input that causes pain. Now, conservative treatments are ineffective and only designed to delay joint replacement surgery. No. Exercise, education, and weight loss, where appropriate, are essential interventions for all people with osteoarthritis, regardless of the disease progression or symptom severity. So treatment begins from you on. If you try to reduce weight, change your lifestyle, do exercises, maybe you will keep the doctors at bay. Prescribed exercises or physical activity programs should be collaboratively designed, should challenge the patient and promote a training response, and should incorporate strategies to enhance adherence. Joint mobilization may be beneficial if clinically indicated. Now, joint replacement surgery is inevitable. When it goes to, if the whole wood or the jungle has taken fire, you cannot just wait and watch. Similarly, when the joint is totally gone, total joint replacement continues to be the valid treatment option for people with advanced hip and knee osteoarthritis. But total joint replacement surgery is not appropriate for everyone with OA. We have to see also whether this patient is fit. They have a lot of comorbidities, and those who have body mass index of very high, they are not going to be benefited. Disease progression differs from person to person, and many people may never reach to the point where total joint replacement is appropriate or necessary. So in summary, OA is a chronic disease with no cure or modifying treatments. Need good plain X-rays to determine the disease. MRI not warranted. Arthroscopic treatment is not so much helpful. Use published clinical practice guidelines, CPG, for non-operative treatments. Can postures cause problems? Regular walk or long distance over rough ground and frequently lifting of heavy objects? Yes. High stressful lifestyle, high obesity and less movement, bad sitting and standing habits like squat and sit cross-legged for a long time. Life is movement, movement is life. Keep it in mind. And I'll show you some of the cases which will show you how we deal with them. This lady came from Bangalore to me. I had done high tibial osteotomy. That means I had cut the bone at this level and made the leg straight. But after 10 years, this was total joint which was involved. So total knee replacement was inevitable. I replaced her both the knee joints. This is one right-sided, and this is of the other side. So this is post doing both the knee replacement. She's 77 years and left I had replaced earlier, but then her son got married and she didn't want right-sided to be done. Similarly, spent 5 years. I gave her injections, viscose supplement, and we could pull on. But then inevitable was we had to operate on the right knee. So I replaced the right knee also. Now, this is a very wonderful patient of mine who's a watch repairer. He is like a pituitary dwarf, like we have clowns or jesters in a circus. His height was only 4 feet 1 inch, 49 inches. And he had leg which was bent to the level of 70 degrees, which is very rare. You can see this angulation. And he would have required smaller than the smallest size available for total knee replacement. So I did the replacement of the knee joint in 2008. And it's almost 14 years now. He travels all the way from Borivali to VT in Mumbai, which is quite a long distance, and to travel in second class of trains of Mumbai is really a big hurdle race. This is how it has been replaced. And his height also, he gained almost 2 to 3 inches. You can see the crooked legs here, and now they have been made straight. He walks also quite well. This is his in straight leg. This is how the leg is bent. And this is how we call this a scanogram. It looks like with the joint replacement. And he is very happy. So happy is the scene when the patient comes at the right time, you give the right treatment. And we follow the 9 steps for arthritis treatment. Reduce the cause. Initially start with some supplements which help you. Improve the biomechanics, exercises, diet, behavioral, medications. And if it doesn't work, then surgery. There could be other modalities also of the treatment. Thank you very much for paying wonderful attention. If there are any questions, and I will stop sharing my screen so that we can see everything what is happening in the chat box.
Thank you very much. Thank you very much, Dr. Shah, for an amazing presentation. I see that there are not too many messages in the chat today, but there are some messages which I have got by SMS.
Sure, you can go ahead. And if you have also question, you can start with them.
Yeah, so the first question that is there is, Dr. Shah, how much does a total knee replacement cost? And I'm a senior citizen and I do not want to depend on my children to take care of the expenses. And I'm told that not all the expenses are covered by medical insurance. Please help.
It's a very nice question. It's a burning question for every candidate who needs total knee replacement. Now, we are all educated people. Those who are less educated, they also know what is Mediclaim. When you take your Mediclaim insurance, believe me, today insurance should be of at least 10 lakhs you should have.
Right.
If you have 10 lakhs, then only you can use a room which is 1% of that. That will cost you 10,000. If it doesn't suit you, then have as much as you can have. Total knee replacement costs quite a lot. The implants or the prosthesis what we use are going to last you for at least 20 years. So we use the best of the prosthesis or implants. That means the spare parts what we put. And they cost somewhere around from 90,000 to 1 lakh. Depending on which class you travel. Like in flight, you take economy class, you can take business class, or you can take first class, or you can have your private jet also. Depending on that, the charges are there. It is not that, but poorest of poor people also. I have operated not less than some 200 people where all the implants and everything has been borne by us. So do not feel shy about it, but open your eyes today first. Not only for your joint replacement, but for your any medical ailment, if you are going to get. You have brought up your children in very nice way, but I'm sure your children have flown away. They are out of the country, or they have gone away from your city to another city. They can help you little bit by giving little money. So you have to be on your own. Have your own medical insurance. That is very important. And up to 50,000 is given off by income tax department also. So use your insurance premium, which you are doing, to reduce your burden of paying income tax and have healthier and happier life, so that in the hospitals, you are not treated like one below average class person, but you go with dignity and get treated. But do not feel shy. There are institutions. I have worked in Nayar Hospital for practically 30 years, where we have done total knee replacements absolutely free, including all the implants. So you have from zero up to sky is the limit, what expenses you will be bearing. I hope that answers.
I've got a question immediately on this. Doctor, you mentioned about Nayar Hospital, which is a government hospital. Are these hospitals, do they give you the same facilities and care as private hospitals?
I was very clear when I said you can travel in economy class, so you cannot ask for extra leg space. I hope that's very clear. And if you travel in second class, you know the difference. If you travel in first class, you know the difference. So do not expect the heaven out of it. But if you are lucky, you may encounter good kind of staff and you will be treated well. But if you encounter any difficulty, there is always complaint box and you can complain over there.
All right. Doctor, I have a question from Mr. Dinesh Paliwal, who asks, can slow jogging affect the knee joints badly?
Sir, I'll be very blunt and say that do not do jogging unless you have a jogging track. There are artificial tracks laid. Like if you are in Mumbai, there is Priyadarshini Park or Mandra's Joggers Park. when you jog, you load your particular knee when you are on the standing stance 3 times your body weight. When you are running, you are putting the weight 2 times. And when you are walking, it is 1 time of your body weight. So you only can understand that if you load your knee 3 times, then you are going to harm the knee. So it is better to do fast walking, brisk walking, running, but jogging on not properly laid out joggers tracks is harmful to the knee.
Right. Doctor, we have another question that has come in. This is from Chitra Khandekar. Actually, there are 2 questions. One is, what exercises must be done on a daily basis? And the second question is from an anonymous attendee who asks, is it better to exercise in water?
Lovely questions. See, I elaborated more on the knee arthritis. There are hip arthritis which are common in Western or European countries because they have dysplastic hips. Like if you know Marilyn Monroe, she had also dysplastic hip. She had dislocation of the hips, which I didn't include. And we wanted to finish off, and this is the burning question of the knee arthritis. So exercises are in 2 phases. One is static quadriceps exercise. If I can request Pradyumna sir to focus the camera, go away from there and make the knee joint straight. If you can show on some table or something, otherwise I'll immediately send a video and play the video for you. Or you can learn, make your knee absolutely straight and then make your kneecap absolutely tight and hold it tight for 5 seconds and then release. That is known as static quadriceps exercise. You may start with 100 times in a day, increase to 200, 500, 1,000 times or uncountable times. You may do it in standing position if you are in kitchen or you are working. That is one. Secondly, bend your knee, extend your knee. Bend your knee, extend your knee. 20 in the morning, 20 in the afternoon, 20 in the evening. That suffices. And static quadriceps is your knee is absolutely straight. Make the kneecap tight. Hold it tight for 5 seconds and then release. Again, make it tight for 5 seconds and release. So these 2, one is static quadriceps, other one is knee bending exercises.
You know, those of you who have attended Dr. Ali Rani's session, which he had conducted a few weeks back, would note the exercises that he recommended. And if you weren't there in it, or if you don't remember what he had said, these are there. The session recording is there on our archive, which is at seniorstoday.in/webinar. So you can check Dr. Ali Rani's session. Dr. Irani, of course, as we know, is a colleague of Dr. Shah at the Nanavati Max Hospital, and he's a very well-known physiotherapist. So he had advised something. Doctor, what about walking in the water? Is that something that is an advisable thing? Yes,
Because when you walk, this is like you are doing resistance without loading. So it is very, very helpful, especially those who have weaker muscles also. They will do wonderfully well. And these are hydrotherapy, in fact, and they help you a lot. And believe me, one of the best exercises is swimming, where you don't load your knee. At the same time, you are getting best out of your muscles.
Right. Doctor, we are at 5:35. We're running out of time, but I have a few more questions that have come in. One is from Reena Manglani. She says, my husband is 69 years old and he's diagnosed with rheumatoid arthritis of the knee for the past 6 months. HT has been tried, physical therapy and methotrexate. It has not helped him much. What do you suggest?
Madam, if he has been diagnosed just 6 months ago, that means he has better outcome. Methotrexate is not going to work like wonders, but it is a disease-modifying treatment, and do not give it up. Only thing is you cannot give it continuously, so you have to give off day also. besides methotrexate, we have something called leflunomide. If recently diagnosed, you can start with leflunomide 20 milligrams. And then once you feel better, you can step it down to 10 milligrams. Although steroid is supposed to be very bad in initial phases of rheumatoid arthritis, it changes the progression of the disease so dramatically that it's a wonder drug. But then it cannot be given without a prescription of the doctor who is treating. So a rheumatologist or an orthopedic surgeon will be absolutely correct. There are some people who are resistant to all these kind of treatments. Then there are some injections also available and we can use them. But if he has been diagnosed recently, he has better outcome, and please stick to the medicines which have been prescribed by your rheumatologist or your doctor, and we can treat the disease. We cannot cure the disease. Remember that. So there may be waxing and waning, but treatment should go on. There are days when you don't need the treatment at all, but there are days when you will need high level of medicines. If you use disease modifying medicines, the disease is not going to progress so rapidly as it would have been done, and methotrexate is one of them.
Right. We have a question from Mr. Philip Olisa, who says, can a diabetic person undergo knee surgery?
Most of our patients are diabetics. They have triple component, very obese, weight not less than 80 kilos. They are diabetics. They have hypertension. Some of them have ischemic heart disease. So we have to deal with all these problems. So we work in a team. We have a physician who is going to make all the corners all right, and then we operate on the patient. But such patients who have high risk, we do not replace both the joints in one sitting. We take permission of the physician as well as the anesthetist. Then and then only we do both the knees together. Otherwise, we space them either 6 weeks or 6 months, one knee after other.
Thank you. We have a question from two questions from anonymous attendees. One is, why do male above the age of 40 get osteoarthritis early on onset in the fingers? How does one supplement calcium in the diet for lactose intolerant?
Listen, what you see on the digits near the nails are Haberden's nodes, which are because of osteoarthritis. We cannot do anything great about it. It's only part and parcel of osteoarthritis, but somehow it gets limited only up to the digits. And you talked about calcium. Calcium is an essential part to strengthen your bones so that they don't become porotic. We call them as osteoporotic bones. So a good amount of calcium to the tune of 500 milligrams in your diet or as a supplement. And the supplement what we give, many people have a wrong notion that they will create kidney stones and stones elsewhere in gallbladder or something. No, these medicines do not cause stones anywhere. But if you have doubt, then you can take in continuity of 2 months, give a break of 15 days, again take for 2 months. But calciums are essential. At the same time, we do not give emphasis on vitamin D, which is also equally essential. And you try to bring it to the level of between 30 to 60 units. And you must take vitamin D supplements. If you are having insufficiency, that means less than 10, then you need injections of vitamin D also to bring to the level of at least 40. So in combination, vitamin D and calcium, they work in harmony and they strengthen your bones so that all your other problems also may not be so bad. Once you have less of calcium, less of vitamin D, your progress of all the diseases will increase. So have that supplement necessary. At the same time, even other vitamins, B complex, etc. are necessary, which I'm sure everybody is taking.
Right. Doctor, the questions are just coming in. So I'm
Sure.
going to just restrict to 3 questions. One is Mr. Anil Kumar Chopra. He says, what is cell therapy? He's 72. Doctor has advised immediate operation. I do regular exercises for 2 hours.
Sir, there are many components which help you in deciding what line of treatment you will need. If you are incapacitated, you cannot walk well, then looking at your x-rays, if it's showing gross osteoarthritis, there is no other alternative but to go for joint replacement. Cell therapy is like either it works or it doesn't work. It's very difficult to say. It is in still infancy phase, and if you do cell therapy and if it doesn't succeed, you may blame me. So at this moment, we go critically about it. If the knee joint is bad, you go for joint replacement. If it's good, you do enough exercises, and if you are able to do your day-to-day activity, but you want to be a marathoner, you want to be a jogger, which is not possible. So understand your limitations, but what are your expectations? According to that, you want to do day-to-day activity, you want to play some games also, then joint replacement will help you. But you have to see that you are incapacitated, you cannot do your own work, you find it difficult to go out, you are social outcast, you cannot go for shopping. Yes, you need joint replacement. You may try cell therapy, which may not succeed, so you cannot blame me. I am suggesting a very clear-cut answer. If you have difficulty, go for joint replacement.
Thank you. We have a question from Mr. Dilip Dalal, who says, can anesthesia given during the total knee surgery cause brain stroke to patients?
Sir, the anesthesia per se does not cause, but when you give anesthesia, it reduces your blood pressure. Because we do this surgery, the moment one injection is given either in your layers of the spinal cord, which is known as spinal anesthesia, or in the layers outside, which is known as epidural anesthesia, may cause reduction in the blood pressure. And if blood pressure is reduced to the level less than 70 or something, then the brain doesn't get enough oxygenation. That may lead to stroke. But anesthesia in itself does not cause stroke. So as an effect of anesthesia, if the blood pressure has dropped down tremendously during the surgery, which we monitor every second, if we are doing a replacement of the joint in the hip, then when we put the cement into the medullary canal, then the blood pressure can fall very, very down, and that can be one of the causes of either embolism or maybe a stroke. But we take utmost care and make sure that this kind of mishaps do not happen during the surgery.
Thank you, Doctor. One last question that we have is, again, from an anonymous attendee. Is glucomycin effective for reducing OA after the age of 75? And the other question that he has is, if there's an inflammation or swelling of the knee on a more or less permanent basis, but there's no pain and also walking is not adversely affected, can one continue indefinitely without doing anything except for walking and some quadriceps exercises and also keeping body weight in check?
A very full question, which was self-explanatory and answering also well. Glucosamine is a kind of nutraceutical, or we can say it's a kind of adjuvant to what we give as treatment of exercises, etc. And it definitely helps you in improving the cartilage. But there is a limitation only in early to moderate osteoarthrosis. If it is severe kind, it will not help. It's a waste of money. So first, at least for the sake of deciding what line of treatment, you should get x-rays of your knee and come to a conclusion what level of osteoarthritis you are having. If you do not have more than moderate, then glucosamine forever also will help you. But then exercises are also, I'll give more emphasis. And if you do exercises regularly, maybe you don't need this kind of nutraceuticals also. And in between surgery and nutraceuticals, we have injections available. So anytime you have more pain and you cannot do your daily activity, the injections, which we call as viscosupplement injection, can improve the lubrication as well as shock absorber effect of the knee joint, and you can work like a very healthy person.
Thank you very much, Doctor. Thank you very much for your time today and for answering so many questions that we've had from our readers. Once again, It's been a pleasure to have you, for the second time on the health webinar, and for perhaps the 7th or 8th time on a Seniors Today forum. So thank you very much for being there. As always, it's very good to have you and to talk to you.
Okay, then.
Absolutely. Thank you very much.
75 years of independence also will celebrate. And thank you very much, seniors. All of us can be today together and enjoy medicine, music, and all the things in life which will help you and will bring more happy years in your life, and more happiness will be added to more added years of your life.
Thank you very much, Dr. Dilip Shah. And thank you, everyone. We will be back again next Saturday. That is next Saturday, which is the 20th of August at 5 p.m. with another session of Health Live at Seniors Today. Thank you very much.
Thank you very much, Pradyumna sir.
Thank you very much, sir. Thank you.
Subscribe now and press the bell icon. Never miss an update.